Welcome to the podcast. Before we begin, there is a disclaimer we have to make. Let's Talk Wellness Now brings expert insights directly to you. Please note that the views and information shared by our guests are their own and do not necessarily reflect those of Let's Talk Wellness Now, its management, or our partners. Each affiliate, sponsor, and partner is an independent entity with its own perspectives. Today's content is provided for informational and educational purposes only and should not be considered specific advice, whether financial, medical, or legal. While we strive to present accurate and useful information, we cannot guarantee its completeness or relevance to your unique circumstances. We encourage you to consult with a qualified professional to address your individual needs. Your use of information from this broadcast is entirely at your own risk. By continuing to listen, you agree to indemnify and hold Let's Talk Wellness Now and its associates harmless from any claims or damages arising from the use of this content. We may update this disclaimer at any time, and changes will take effect immediately upon posting or broadcasts. Thank you for tuning in. We hope you find this episode both insightful and thought-provoking. Listener discretion is advised. Now for the show.
Hello and welcome back to Let's Talk Wellness Now. I'm Dr. Deb Muth and I'm thrilled to be back on the air with you. It has been a journey getting here. And if you're tuning in after our break, I want to thank you for sticking with us. Your patience, your support, and your messages over the past 2 years have meant the world to me. And today I want to take some time to explain why we've been away, what I've been navigating personally, and most importantly, where we're heading with the show. So grab a cup of tea, get comfortable, and let's talk wellness, now more than ever. As some of you know, Let's Talk Wellness Now went off the air back in 2022. A lot of factors led to this decision, and to be completely transparent, some of this was just out of my hands. My mission in creating the podcast has always been to provide a space for open, honest conversations about health and about real wellness solutions, including the types of treatments and approaches that you don't always hear about in mainstream media. But in the past few years, this world shifted and speaking my truth became, a little complicated. During the pandemic, like many practitioners, I found myself facing increased scrutiny over my views. My commitment to sharing alternative perspectives on health, including my opinions on the virus, and the importance of medical freedom. And this was all met with some opposition, as you can relate. As a result, the Medical Licensing Board reprimanded me, and it was a really challenging time, to say the least. So part of our break was due to that pushback, a result of censorship and having my voice suppressed. Being silenced was really difficult for me, especially as someone who's been devoted to helping patients and sharing knowledge for so many years. At first, it felt like I lost my ability to connect with all of you and to share openly and honestly, and to discuss what I knew to be true about health and healing. But I realized it was also an opportunity for me to pause, reflect, and ask myself, what do I really want to bring to this podcast? How can I make an impact in a way that feels right and true to my mission? And while all of this was happening, I was also facing my own personal health journey. In the past couple of years, I was diagnosed with multiple sclerosis, MS, and I had to navigate this diagnosis and, even more importantly, take the time to heal. I needed to step away, not only to allow my body to recover, but to explore the very treatments and wellness solutions that I have advocated for throughout my career. This wasn't just research, it was living proof of how functional medicine and integrative approaches could change the course of my health. I spent time delving into therapies that in some ways were controversial and not widely accepted. I focused on reversing MS symptoms, with methods that emphasize the whole body treatments that look at infections, nutrient deficiencies, mitochondrial function, and even emotional healing. And I'm thrilled to share that this journey has been truly transformative. I can sit here with you today and say I feel stronger, more vibrant, and more committed than ever to this path. So, where does that leave us? What's the next step for Let's Talk Wellness Now? Let me tell you, I am more excited than ever about the direction that we're taking. Moving forward, this podcast will be bringing you deeper, more detailed conversations about health. We'll be diving into cutting edge topics, many of which you may not hear in mainstream, and that's by design. My goal is to bring you information that can empower you, topics that are evidence-based yet bold. Topics like mitochondrial health, stem cell therapy, advanced hormone therapies, and strategies for managing chronic conditions like autoimmune disease. Our episodes will still feature relevant guests, experts, and practitioners who are doing groundbreaking work in their fields. I've been inspired by people like Dr. Dan Goodenow, who are on the forefront of health research. And I want to bring that kind of inspiration and depth to you. But I'll also be guiding you through solo episodes where we'll explore some of these powerful health strategies step by step. I want each episode to give you actionable insights, whether it's a new perspective on familiar health issues or an entirely new tool that you can apply to your life. Let's Talk Wellness Now will be about more than just listening. It'll be about learning and implementing real solutions. And I want to emphasize this. Let's Talk Wellness Now is not just a podcast. It's a community. It's a space for like-minded people to learn, explore, and ask questions. And I want you to feel empowered to take charge of your health journey. If my journey has taught me anything, it's that knowledge and empowerment are everything. So whether you're tuning in for information on cutting-edge treatments or seeking encouragement on your own health path, you'll find it here. We'll tackle questions like, what's the science behind using peptides for immune support? How can mitochondrial health influence chronic disease? And what role does our emotional and mental health play in physical healing? We're going to get into the details, the real nitty-gritty of wellness, and make sense of what truly helps the body heal. I invite you to join me as we move forward in this new chapter. Each episode will be designed to inspire, inform, and hopefully empower you. I'm honored to be back with all of you and more committed than ever to sharing what I've learned, both as a practitioner and as someone who has been on my own healing journey. So as we relaunch Let's Talk Wellness Now, I want to thank you again. Thank you for your patience, for your loyalty, and for your belief in this work. Together, we're going to keep uncovering the truths about health and wellness that everyone deserves to know. So stay tuned for next week's episode, where we'll dive into the common misdiagnoses in healthcare. And remember, you're not alone on this journey. We're in this together.